You know, I am really proud to be here today to even make the suggestion that the fight against breast cancer in New York took a giant step, an enormously giant step forward when Governor Cuomo signed into law legislation which was sponsored by Senator Flanagan and myself, the Breast Density Informed Law, which now has taken effect as of January 19th, I believe. Roughly 40% of the women who have mammograms have dense breast tissue. And because dense breast tissue appears white on a mammogram and cancer also appears white, it can be difficult to discern as to whether there is any cancer that is present. A January 2011 study by the Mayo Clinic found that in women with dense breast tissue, 75% of cancer is missed in the mammography alone. This new dense breast density legislation, which took effect, as I noted, will improve breast cancer detection and prevention by requiring mammography services to inform patients if dense breast tissue is found during an exam. Currently, there are no requirements in law for patients to be alerted to breast density, one of the leading risk factors for breast cancer in women. Now, women with dense breast tissue, which can mask tumors, making early detection more difficult, will get the information they need to determine, along with their physicians, whether further screening is recommended. The new law requires mammography providers or radiologists to include the following notification in the report provided to patients who are found to have dense tissue. Your mammogram shows that your breast tissue is dense. Dense breast tissue is very common and is not abnormal. However, dense breast tissue can make it harder to find cancer on a mammogram and may also be associated with an increased risk of breast cancer. This information about the result of your mammogram is given to you to raise your awareness. Use this information to talk to your doctor about your own risks for breast cancer. At that time, ask your doctor if more screening tests might be useful based on your risk. A report of your results was sent to your physician. This will raise awareness, educate women with dense breast tissue about the importance of following up with their physician. I want to applaud JoAnn Pushkin, a breast cancer survivor whose later stage cancerous tumor was hidden from detection by dense breast tissue, and so many courageous advocates as well who worked so tirelessly to ensure this life-saving legislation was passed. Simply put, this legislation is about saving lives. Supplied with information about their own breast density, women will now be empowered to discuss additional screening options with their physicians. With the approval of this new law, we will have better health care information to pursue other screening options to find cancers early, when they are most treatable and survivable. And now it is my honor to introduce Senator Flanagan.
Thank you very much. I want to thank the Assemblywoman, and I want to thank the Governor for signing the bill into law last year, and obviously now it becomes effective. We're joined by our colleague, Dan Lasquadro from Suffolk County. He and I represent the same area. He obviously serves with the Assemblywoman, and I want to start by just quickly talking about JoAnn Pushkin and put a human face on this, because this has been very educational for me as a legislator, as a husband, as a parent, as a father, particularly with a daughter who's 24 years old. And I'm going to put this from my own view. Every time I hear about JoAnn's story, I'm ecstatic because of the work that she's done, but it breaks my heart a little bit to listen to it because, frankly, this is the kind of thing that shouldn't have to happen. So she's awesome in so many different ways, and I'll come back to her in a second. But when we went through this process, the Assemblywoman has done an outstanding job, and she is soft-spoken, but she's tenacious. And you have to be tenacious when you do this because we ran up against some brick walls. And we ran up against some brick walls, tried to get people to come around to our way of thinking, which ultimately we thought was the right thing to do. But there were entities and organizations who were patronizing at times, paternalistic in some ways, and overbearing. And I recall listening to medical professionals, and I want to be very, very clear. Overwhelmingly, the people who work in the medical profession are incredibly dedicated, they're professional, but frankly, it doesn't mean they're always right. And sometimes that's what the role of government is supposed to be, And I look at this as an opportunity for us to be able to say, while we have challenging jobs, this is why we have really cool jobs, because we actually get to try and help people. So during this process, we would have some people say to us, well, all you're going to do is scare women. You know, you're going to create unnecessary anxiety. And the science is evolving and everything is changing. So ultimately, we compromised. But I have to tell you, the thing that's kind of stuck with me and kind of sticks in my craw is when I listen to people say, you're going to make women all kinds of nervous that they don't have to be, which is absolutely ridiculous. This is about women's health. It's about early and better detection. And it's about information. Because some of the comments would make you think that somehow the women who would be sitting down with their medical team or professionals can't figure it out. And to me, frankly, that's offensive. What you're really trying to do, what we're trying to do, and what JoAnn has done, is to give people information so you can make an informed judgment. And I am elated to join with the Assemblyman and the Assemblywoman to be here today and to highlight what we're doing. And when you have a huge public survey that says 95% of women don't really know much about dense breasts and they don't know whether they have dense breasts, that's alarming. So if we can make great inroads by doing this, more power to dense advocacy. And I know JoAnn has kept in contact with our office. Virginia is looking to amend their law to follow the New York language. So we're moving in the right direction. And if we have to raise the level of noise and if we have to push harder to get certain things done, we are absolutely going to do that. Now, with that, I'm going to ask Carl if you could just give me this, please. I want to introduce JoAnn Pushkin, who is an advocate, who is a constituent in the district that I happen to represent. But for me, fortunately, and with her husband as well, you transition, not all the time, but you transition, and people who are your constituents, I feel like they're more friends than they are constituents. They've been very helpful to me. And the Assemblywoman and I would like to present to JoAnn Pushkin a pen certificate, and these are real signatures. We have checked it out. So, and with that, ladies and gentlemen, JoAnn Pushkin.
Thank you so much. Thank you. Isn't this wonderful? I mean, I was hoping they would validate parking, but this is even better. Thank you so much. I'll treasure this. Thank you, truly. Thank you.
We'll take care of the parking. Okay.
Thank you. My name is JoAnn Pushkin, and I am here because sometimes silence is not golden. 7 years ago, I learned two things. I learned I had breast cancer, and I learned I had dense tissue. Unfortunately, I learned them both the same day. My nightmare began with a self-exam. I was the model patient, doing everything I was told was right, exercising, eating healthy, and of course never missing an annual mammogram exam. Yet one day I felt a lump. Though large enough to feel, the tumor did not show up on a mammogram that day. Why? What I had never been told, what I did not know, what I had been kept in the dark about, was that dense tissue shows up white on a mammogram. Unfortunately, so does cancer. Trying to find cancer on a mammogram of a dense breast is like trying to find a snowball in a blizzard. By the time I felt my tumor, it was estimated to have been growing 5 years, undetected, every single one of them by mammography. And worse, the letter I received after my mammogram, every one of those 5 years, simply said normal negative, no evidence of cancer. 6 words. Not one word about breast density, not one word that density can drastically compromise the effectiveness of a mammogram, and tragically, not one word about an additional screening tool that might have detected my cancer at an earlier stage, sparing me the horror of 7 surgeries, 8 rounds of chemo, 30 rounds of radiation, a recurrence, and now the rest of my life lived as a time bomb. When I asked why I had not been informed about my own breast density, I was told it was not the standard of care. I am living the horror of a later stage cancer diagnosis because no one had to tell me I had dense breasts. This week, that silence ends. This week, New York women become the first in the nation to be told in clear, unambiguous language if they have dense breasts. Research indicates that every year, at least 2,500 New York State women leave their mammograms being told, as I was, that all is normal and negative, but who actually have invasive breast cancer that would be found if they were sent for screening ultrasounds. That's a 9/11 every year of missed invasive cancers. To their great credit, from the moment Senator Flanagan and Assemblywoman Jaffee committed to draft the bill, they threw the full weight of their offices and political capital at it. This powerhouse team from both sides of the aisle never wavered in their commitment to get density information to New York women. New York is one of 5 states with a mandatory breast density inform law, but our New York law is the most comprehensive in the nation and serves as template to other states when they draft legislation. Before I leave, I asked Senator Flanagan, Assemblywoman Jaffee, Governor Cuomo, and their amazing staffs to allow me to speak on behalf of those 2,500 women a year whom they will likely never meet. Those 2,500 women a year who will never know how hard you worked for them. Those 2,500 women a year for whom this law will avert horror stories in the form of late-stage cancer diagnoses. Because of your tireless work and vision, there will be husbands who will not become widowers, children who will not be orphaned, and families that will not be shattered. Your legislation will save lives and spare New York State women an untold number of tragedies and tears. My husband and I have no words to adequately express our gratitude for your hard work on behalf of New York women and the people who love them. I can only make you this promise. If I get to heaven before you, I will save you good seats.
And now you've heard from a woman of extraordinary strength, courage, excuse me, and incredible, a woman of distinction who truly reached beyond to assure that women in New York State will have this opportunity to understand about their bodies and be empowered to be able to make the decisions accordingly. JoAnn, I thank you so much. You are a heroine in my eyes. Thank you. Thank you.